Did you know that thousands of children are born in India with congenital hearing loss? And this type of hearing loss can be easily corrected with a device known as a cochlear implant. Hi, my name is Dr. Suven Kalra. I am a senior ENT consultant surgeon at Max Hospital Shalimar Bagh and a cochlear implant surgeon. So today I'll be talking about a few points regarding the cochlear implant device and the surgical procedure that we usually do. So normally our hearing works in the way that sound is received from outside. It is picked up by the eardrum and it is transmitted through three small microscopic bones into the inner ear or the cochlea, which is the main organ which converts sound into electrical signals. These electrical signals are picked up by the nerve for hearing or the auditory nerve and transmitted to the brain. Children born with congenital hearing loss usually have a problem with the cochlea, in that the cochlea or the inner ear is not converting sound signals received from the outside world into electrical signals which can be perceived by the brain. To correct this problem, we use a device called a cochlear implant, which basically picks up sound from the outside world and converts it into electrical signals which are perceivable and understandable by the brain. These electrical signals are taken via the auditory or hearing nerve to the brain, where the brain can perceive them as sound. The cochlear implant device basically has two parts. One part that is surgically implanted behind the ear under the skin, and another part that is worn outside and attaches to the part under the skin magnetically. The part outside picks up sounds and transmits wirelessly the electrical signals to the part inside, which then converts it into electrical signals and provides the signal to the auditory or hearing nerve. Now, each device has a very high reliability and a success rate because each device that is manufactured bears a serial number, and each device is followed up by the manufacturer through the whole life of the device and reported to the FDA in the USA. So the chances of device failure or the chances of not being successful are almost nil. The success of a cochlear implants depends not only on the surgery but also on the habilitation, which is done for about 1 year after the surgery, and also the success depends on the age at which the implant was done. Typically, the implant is most successful if it is done before the age of 5 years. Therefore, early detection and early picking up of hearing loss is of extreme importance. We have a program called Universal Newborn Hearing Screening, in which all babies born are screened for congenital hearing loss at the time of birth by a simple test called an OAE test. Therefore, in conclusion, I would urge you all to have your babies and have your children screened for hearing defects early on.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.